Good afternoon. Health and Human Service will come to order. Madam Clerk.
Commissioner Baker McCormick. Commissioner Marecki. Commissioner Anderson. Commissioner Colleen. Chair Scott,
Present.
you have a quorum present.
Thank you. All right.
B, Chairwoman's remarks.
I have none today. Thank you.
C, approval of the April 22nd, 2025 meeting minutes.
All right. Commissioner Colleen, supported by Monique Baker McCormick.
Please vote using your
Favor.
tablets.
Oh, just this?
Yeah. Try to click now, maybe with the mouse. Let me see. There you go. You can click now.
Oh, no.
Motion carried.
Thank you. Next item, please.
D, unfinished business. There is none listed.
Okay, next item.
Item 1, under new business. Forwarding the Youth Assistance Program's yearly outcome and program description for fiscal year 2023 to 2024.
Okay. Good afternoon, Mr. Tucson.
Good to see everybody again.
Good to see you.
Yeah, so we're just here to submit the youth assistance report, the yearly outcome report. So a few things I just kind of wanted to note was that we've had 807 youth participate with a 81.8% successful rate of participation, sorry. And then also that number did increase. Last year we had, the year 22-23, we had 786 youth. Last year it was 803. And I don't know if you all saw this in your report, but we just broke down the budget on the last page. So in the year of 22-23, we put in $843,000 from the county, but last year, because of the 75% increase for child care fund for diversion prevention programs, we only had to put in $424,000. And lastly, I'll say we have a RFP out now that we're going to be increasing the funding for the youth assistance program. So we'll have more people doing the work in our communities. And we increased that funding to about $2.5 million. And I'm all set unless you have any questions.
Thank you. Commissioner Colleen.
Thank you, Madam Chair. Good afternoon. The youth continuing in services of the program, I saw, there's transportation issues and stuff. So for those 120 kids from last year, it says continuing in the what does that mean? Is it going to be the same program?
Yeah, so basically you're saying like the kids that are continuing services,
Right.
Yeah, they basically continue through the YAP service. We talked about like, extending their time. So if most youth do 91 days, as you can see in the report. So they extend their time. It could be 6 months up to a year as well.
Okay. And what if for a second time it doesn't happen?
We continue the
We
services.
continue it?
Yes.
Okay, okay, good. I didn't see the budget numbers you were talking about.
That was on the final page of that report. I'm not sure if you are. Yeah, I can give you a copy.
Yeah, I didn't see numbers.
So we put a, basically, I don't know. Let me pass you a copy, sir.
Sorry.
All right.
Okay, I'll get it from you.
You sure?
Thanks. Thank you, Madam Chair.
Thank you. Anyone else?
Okay.
Commissioner Baker McCormick.
Thank you, Madam Chair. The 81% participation, when you say participation, meaning that they completed, what do you mean exactly by participation? And what happens with the other youth that I guess aren't participating?
Absolutely. So The 81% we're talking about saying that you've completed some service.
Okay.
So, yeah, so we're basically saying they complete the services. And of course, as we stated, some youth stay longer, which is, we're talking about the other youth, 120 youth that we talked about earlier. So if they stay longer, then those are the youth that continue the services, the ones that did not complete it, or if they just completely dropped out. So.
Okay. And are these youth tethered, or these are the in the detention center only?
No, so these youth are actually diversion youth. So the goal of this program is to keep kids from, entering that system. Yep.
Yep, I get it. I was thinking for some reason, but we're talking about, okay. Yeah, that was it. Thank you.
Thank you.
Okay.
Commissioner Mareki.
Thank you. So how long do you follow them after they complete the 81% that completed everything? How long do you follow?
That's a great question. 6 months?
No,
No.
so we don't have, for the YAP, we don't have a recidivism study or tracking. Once they complete the goals, then they leave. And so part of the prevention program and diversion is really, they haven't been in the system. And so we tried not to treat them as formal as those kids with recidivism. And it's something that we can look into. And as far as tracking, do you have a job? Do you have school? Those things, but.
Do you know how many, if something happened again, they could come back into that do you have those numbers?
We do, and we can get those to you. So we
Yeah.
do have that. We have that continuum to see, prevention, diversion, formal enrollment into the system. We definitely can share that with you.
Okay.
So we'll provide a
Understand.
response.
All right, thank
Mhm.
you. I'm set.
Oh, Commissioner Colleen. Oh, yes. Okay, I thought you wanted, okay.
But Madam Chair, yeah, I'll move to approve, but Madam Chair, if I just may, I just wanted to comment. In 2 years, one person was escalated to a placement, and I assume that's a secure residential.
Yes.
But I think 1 in 2 years out of, 1,600 kids, I think speaks volumes to what the program does and selecting which kids go into it.
Absolutely.
And, but I think it's marvelous that there's that kind of track record.
Absolutely. And we are, we hope to expand it. As Tucson said, we have a new RFP that just closed, and we're hoping to have more providers because it's such a great program, and we are seeing the numbers increase significantly.
Okay. Director, you want to give your name, please?
Yes. Good afternoon, Melissa Fernandez, Director of Juvenile Youth Services.
Thank you.
Thank you.
Commissioner
Okay,
Mareki.
thanks. So why are the numbers increasing, do you think?
That's all the questions are great, but that's a great question. So what we're seeing is with juvenile justice reform, there really is an intentional shifting of trying to keep more young people in the community. And so we're seeing more young people being diverted by the prosecutor's office. We're seeing more young people being put on tether, which you'll hear in a minute. And we're seeing a decrease in young people in detention or level 2. Part of it is really right sizing where kids need to fit in. Today in detention, we have 84 kids in detention. And so that's part of the right sizing with juvenile justice reform. So as the secure placement and detention is decreasing, we're seeing an increase on the front end.
Okay, that makes sense. And I'm sure you're going to follow that.
Yes,
Just to make sure. I mean,
it's appropriate. Yes.
yeah,
Yeah.
public
safety.
safety is very important.
Yes.
So,
Do they all come through from the prosecutor's office?
No, so you have the youth that are diverted, which goes to Right Track, and that's through a YAP program as well. But most of these kids are referred for services. So that's like, that can be a community member, that can be a parent, school, yes, they all don't come through. But we know that the people the closest to them know the most about them. So
Okay.
they refer them to the YAP programs.
Very good. Commissioner McCormick.
Thank you.
Mhm.
And I was I was on that same track. But the referrals, how are you getting information out to the community so that you get these referrals? I mean, are you making sure that this information is in the schools, the counselors? What does that look like?
Absolutely. So it's a few things. One is that, and Melissa can attest to this, we get a lot of calls into our office about youth that about parents who need help with their youth. So we refer them that way. So we have a list of YAPs. So we say, hey, you're in this zip code, so you should contact this YAP, which is great because imagine if you're out in Inkster, you have a YAP that you can go to right out there. So you don't have to travel. And also, what I've seen when I first start doing site visits, a lot of them go to the schools. They recruit from the schools. They go to like community fairs. They let them know the services that are available because they have a lot of services available: counseling, substance abuse. They have a lot of different services that you can go to. So if a parent is calling or need help with their kid, those providers are definitely providing that service for them.
And we
Okay.
did recently put together a resource guide.
Yes.
It's almost completed and we will share with all the commissioners to share with
That was
your
the next-
constituents. Yeah.
Yeah.
And also, we had a community resource fair recently, but
Yes.
we'd definitely like to, attend your community meetings as well to discuss
Yes.
the availability.
That would be great. Yeah.
Great, yeah, that was that was the second part, and we get some information
Absolutely.
that you have put together so we can also share it in
Yes.
our communities.
So yeah, if you had a community meeting, we could reach out to that YAP in your area and say, hey, you should come out and talk about the services that you offer.
Oh,
Yeah.
great, great. It's another question, and it slipped my mind. All right, thank you.
So is this a receive and file? Okay.
Mhm. Yeah. Okay.
All right.
We have a motion to receive and file by Commissioner Khalid and a support by Commissioner Marecki.
Okay, all in favor?
Please vote using your tablets.
Okay, there, it's on the tablet, right? You never know.
Go on.
What day it is? Yeah, what day?
Try clicking on the left side of the pad. Try it.
Motion carried.
Okay.
Yeah.
Okay. Next item, please.
Item 2, forwarding report for the Warrant Enforcement Bureau, including status, activities, and accomplishments of the WEB performance as conducted by Business Unit Department, and comparing the result from fiscal year 2022 through 2023 to fiscal year 2023 to 2024.
Good afternoon, Madam Chair. Melissa Fernandez, Director of Juvenile and Youth Services, and I have Sergeant Sedano here who oversees the web unit. I'll introduce him in a bit here. This is a receive and file for our annual web numbers at Warrant Enforcement Bureau. Just some overview here. Today we have 342 young people on community probation. Out of those 342, 111 of them are on tether. What you'll see from the numbers is that we've had a significant increase of young people on tether. 2 years ago, we had just over 1,000, and in fiscal year '24, we had almost 1,700 young people on tether. Part of that is in line with Commissioner Marecki's, question with juvenile justice reform. We really are seeing a lot of young people being diverted or placed on tether while their cases are being heard. It is increased our tether requirements quite a bit. Sergeant Sedano has taken over overseeing the juvenile tether. I've had the pleasure of meeting him about 3 years ago when he was assisting me with our detention center, and he really has, I think reluctantly at first, but embraced understanding the juvenile population, the intricacies of the juvenile population, understanding it, and has just done a phenomenal job with us and overseeing that department. Because of that, we have had to increase the number of positions in the budget. When I first started 3-4 years ago, we had 50 kids on tether. So you can imagine that from 50 to 111 today, it's a greater oversight. And I did want to acknowledge Sergeant Sedano and ask him to come down here and meet all of you. He definitely can answer any questions regarding specifics of tether monitoring and apprehension.
Thank you. So these do come from the prosecutor's office.
No,
No?
so some of our tethers are court ordered. So the jurist orders the young person on tether. They could be post adjudicated, which means they're under the care of our CMO, or they could be pre-adjudicated. And so the jurist at that time says that they can be in the community on probation with supports and tether, or they might be on tether without a CMO pending a court hearing.
Okay. All right. Okay. Oh, I'm trying to read this thing here. Just Colleen?
No.
It wasn't you?
Go ahead.
I'll take it. Well, good morning again.
Morning.
Yeah, and looking at the numbers, it looks like the Third Circuit's getting more interested in this program with each passing year. You made a comment in your report that caseloads doubled in 3 years and need for increasing support from the Wayne County Sheriff's Office. What's going on with that? Is that going to be in the budget this year?
It is absolutely in the budget. And also, I want to add that Tether and community response programming is covered now at 75% childcare fund. So we did ask for, yes, so we did ask for that increase to be able to appropriately monitor the increase of young people on Tether.
Excellent.
Now,
Good.
the barrier on the other side, as we discussed today, is just the staffing on the sheriff's side and being able to staff it up.
But that is what you're going to do,
That is the request, correct?
okay, for next year's budget.
Yes,
So we'll know in a few months.
yes.
Okay. All right.
Commission-
Thanks, Madam Chair.
Commissioner,
Thank you, Madam Chair. So how does this work? I mean, we have the Tether utilization by fiscal year, and they have the CMOs and the grand totals. How does it work when someone does whatever to their Tether and they're off the Tether? How does this, I mean, does the sheriff's department take care of all this?
So when you're saying off the Tether, do you mean if they're violating Tether?
Violating Tether,
Correct.
whatever.
Correct.
however you
So
violate it.
Sergeant Sedano can, you want to turn it on? Yep, there you go. Oh, turn it on. There you go.
Good afternoon, Madam Chair. Good afternoon, everybody. So, can you please repeat the question?
So when somebody's not, they're off their tether, they're not supposed to be off their tether. How does this work? Because each CMO's got certain kids that are, certain number of kids that are on it, but when somebody breaks the violation, or I don't even know how you word this.
So normally, when a juvenile violates their tether rules, we'll get a notification, and even then, their tether will keep a record of where they've been at what time. We see a consistent pattern that this youth is consistently leaving his home. We'll get contacted by the case manager, or we can see it ourselves, so we have enough time. And we will conduct a house stop and inquire with them, hey, what's going on? Why do you keep leaving your house? Or, you want to talk about, what's going on at home? Like, why do you leave your house? It could be like they just want to, do what they want, or they're having problems at home, and we take care of that.
So their case manager would also be alerted
Yes.
to this
Yes,
happening. So it's case manager and the sheriff's.
and house arrest. So our Tether company
Yeah.
provides all of the monitoring. They do the case management for the pre-adjudicated young people. So they monitor that group of people. So they are monitoring 24/7 live what's happening. If you remember last, I believe September, we transferred all of our monitoring to house arrest. So they are providing the updates live. They have the capacity to talk to a young person through a Tether and say, hey, you're out of your lockdown zone. We need a response now. They have the capacity to set off an alarm. And also, as Sedano said, they also then are alerted live if they need to go out. And sometimes it's just a young person, wanting to be across the street with friends, but we also have been alerted to significant issues where the sheriff's then apprehended someone and was able to bring them back to JDF. Also, Tether tampering. In September, Commissioner Anderson asked a question about Tether tampering. And so there are different levels of tampering and cutoffs, and these guys respond right away.
Okay, so I was wondering, like, is it a pretty good response time most of the time, or sometimes kids are like a week before somebody realizes anything?
It is usually pretty fast of a response time. If they're actively trying to cut it off, I will be notified by house arrest services, and I'll try to put my team together, and we will go address the situation. There might be, they might have lost signal, or they might have might be trying to cut it off. It's happened in the past where we come up on scene and the kid has a hacksaw in his hand, and he's actually trying to cut it off. But yeah, we address everything.
Okay, all right, so it's pretty quick turnaround time.
Yes.
It is, but all the more reason we need to have an appropriate number of sheriffs to address
Sure.
the increase
Sure.
in young people.
Yep. All right, thank you.
okay. Commissioner Anderson,
Along that line, how many additional sheriff deputies do you believe there are needed
Yeah.
to adequately cover this?
So you can probably answer that better than I can. I know that we have 7 positions in the budget. Currently, they've got 3. What do you have? How many bodies do you have?
So as of right now, it's only 3 officers, including myself. Sometimes, depending how busy we are, we can't, oversee everybody. So I've had issues in the past where like I can't get to somebody because I'm tied up with something else.
Yeah. And part of the problem for the vacancies, obviously, is on the sheriff's side and the bodies. We have had a great deal of help, a lot of help from the fugitive apprehension team as well. So they jump in and they've been amazing with helping out
Yes.
the team.
Okay, thank you.
Oh.
Commissioner McCormick, please.
To that point, how often do you have the case where a young person just, escapes? And when you say fugitive, it just makes me think of, something.
I don't know. I avoid the word
Right,
fugitive.
like-
I like the term AWOL, absent without
AWOL,
leave.
Okay.
So I would say it happens a few times throughout the month. And
Okay.
usually when that happens, they'll get a writ, and that's when we begin, the process of trying to find out where they're at. They might be at a friend's house or, just a place they frequent.
Okay. But when you talked about the turnaround earlier as to how quickly you respond, what would you say, hours, a day? What's the turnaround?
It could be within a few hours, depending on
Okay.
availability. Like on weekends, it might be hard to get my team together.
Okay.
But normally, I would say like within a couple hours.
Okay. Okay. And is this a ongoing issue all the time where they're tampering with their tethers? And would you say out of how many did you say? 111
111.
out of those, is it 20 that tamper with it, or do you have kind of the numbers?
Yes, so the last data that we pulled was in response to Commissioner Anderson's question. And in the fiscal year 24, we had 508 young people on tether. 53 of those were tampering incidents out of that number, and 17 resulted in successful cutoffs. So it's not, it's significant, but it's not very high in the annual number.
Okay. Thank you.
All right. Thank you. Commissioner Khalil? No,
No, I'm all set.
You all set?
I'll make a motion.
Okay.
Receive and file.
all right.
Support.
Moved by Commissioner Khalil, supported by Commissioner Anderson. All in favor?
Aye.
All right. Thank you. Okay, next item, please. Thank you both. Mhm.
Item 3, requesting commission approval of a 1-year grant award with the U.S. Department of Health and Human Services to support the operations of Wayne County Healthy Communities, a federally qualified health center that delivers comprehensive outpatient primary medical care, behavioral health services, and dental care to low-income and medically underserved residents of Wayne County.
Hi.
Hi, good afternoon. Dr. Sheth, Chief Medical Officer at Wayne County HHVS. This is a request to accept a grant that is coming to our federally qualified health centers, Wayne County Healthy Communities, in the amount of $500,000 to expand clinical hours in our Wayne and Hamtramck location. And so this is on top of the core funding that they get annually from HRSA for the health center operations to allow for obviously more access to our folks with limited access in underserved communities in Wayne County.
So is this divided to each clinic?
Yeah, so the funds will support expanding hours in both of our sites, Wayne and Hamtramck.
Okay. Are they both getting the same amount? Is that's what I'm trying to?
Yeah, so I'm not completely clear how much each site will receive. There will be, potential for providers to be working at both sites. And so the exact amount, I don't have off the top of my head. We know that Hamtramck is a larger volume clinic too. So there's more resources likely coming to Hamtramck specifically just because there are larger operation compared to Wayne.
Okay. Commissioner Khalil?
Thank you, Madam Chair. Yeah, I think you cleared it up because I look back, being an FQHC, you get federal support annually. That's one of the benefits of it. and I was looking back, and that's about $1 million a year in what we've had in previous years. So that is still coming?
Correct.
Oh,
Yes.
okay. But you can apply for additional funds under certain categories for support, and this is just for FQHCs, right?
Correct.
This kind of dollars. Okay, well, that's great.
Mhm.
Let's
Okay.
expand those services. Thank you.
All right. Anyone else? All right, thank you, Doctor. Yeah. All right.
We have a motion by Commissioner Baker McCormick and a support by Commissioner Anderson.
All in favor? Yes, you are.
Motion carried.
All right, thank you. All right, thank you so much. Next item, please.
Moving to item 4 on the addenda. Requesting commission approval of a grant agreement with the State of Michigan Department of Licensing and Regulatory Affairs to provide education, communication, and outreach services regarding the Michigan Medical Marijuana Act.
Aye.
Okay. Good afternoon, Commissioners. Dr. Brianna Osorio, Director of Public Health Division. And this is a grant acceptance for medical marijuana grant that we received from Lara. We use these we utilize these funds pretty much for increasing awareness on and education on marijuana laws, clearing all of that out, doing outreach events, working with dispensaries as well on safe use and practices, as well as also prevention for at-risk groups as well. So those are all of the things that we pretty much do with these with this grant. But this is an annual grant that we get, and it's based upon the amount of medical marijuana cards that are registered in Wayne County.
Okay,
Or
what
Wayne
areas
County.
is this used in?
What's that?
What areas, what cities?
This is used across, this is actually even including the city of Detroit. So this is all throughout Wayne County. So we have our staff that go out to outreach events throughout the county. We even partner with some of the school districts. I believe that we've even partnered with like River Rouge, things like that. So pretty much everywhere
Okay.
in Wayne County.
All right. All right. Any questions?
We have a motion by Commissioner Anderson and a support by Commissioner Marecki.
All in favor? All right. All right, thank you, Doctor. Next item.
Moving back to the agenda, F, such other matters as may be proper.
Next item.
G, public comments.
Is there anyone online?
There's no one on Zoom with a hand raised and no emails were received.
Okay. Thank you. Anyone in the audience wish to make a statement? Anyone in the audience wish to make a statement? I see some of our providers out there. Thank you for being here. All right, all of you. Okay, next item.
Adjournment.
Been moved and supported. All in favor, we say yes. All right. Thank you, everyone.